A pain in the neck. We're going to talk about the physical causes of neck pain and how it relates to migraines. Neck issues and migraines are related quite frequently. So neck issues have a multiple of contributing factors. It could be a physical alignment problem due to a neck, a head, or a back injury. It could be a physical alignment problem due to incorrect posture, repetitive activity, aging, deteriorating health, or muscle weakness, etc. It can also be tension due to mental stress, and we've covered that in week 3. It could also be neck tension due to emotional stress, which we also covered in week 3. So let's review the physical issues that can be related to the neck in more detail. Head injuries and head trauma. Head trauma is not as well understood as we would like it to be. The brain is so complex. But doctors are learning that even whiplash can cause injury to the brainstem, and any brain or brainstem injury is suspect in contributing to migraines and headaches. This means that people with brain trauma or whiplash are simply more vulnerable to central nervous system problems, including migraines. Neck and back injuries not only hurt the brain, but once you've had a neck injury, then muscles can become weak and tight due to misalignment, which can impinge on blood flow to the head. Neck injuries can also impede nerve flow, or they can cause the jaw to become tight, which can impede nerve flow. Now, low back pain can also contribute to migraines. When your back and your core muscles become weak from injury or poor posture due to aging, other parts of your spinal muscles can pick up the slack to help the weak muscles. When this happens, the jaw can get tight to help stabilize the spinal column. So a weak back can actually cause a tight jaw and impinge on the nerves and the blood flow along the neck. There's also the issue of spinal stenosis, which is a narrowing of the spaces within your spine, and this can put pressure on the nerves that travel through the spine. Spinal stenosis occurs most often in the low back and the neck. Back and neck pain, as well as neck tension, are possible signs that your migraines are caused by impingement of arteries and nerves from stenosis or vertebrae displacement or overly tight muscles in the neck, jaw, or shoulders. Besides trauma, a pain in your neck or shoulders can be caused by weak upper or lower back problems. If you look at these slides, you'll notice that the person on the left has a straight, erect posture. And then when we have the forward neck syndrome, we are weakening the neck muscles, putting a lot of strain on them and a lot of strain on the low back muscles. And this can impinge on flow to the head. Then the next person, you see a nice, light, straight person, and then you've got the forward neck with the belly out and the big sway in the back. That also impedes spinal fluid moving up and down the spine, nerve flow moving up and down the spine, and blood flow. Not good for getting circulation to the head. So something that's less understood is nerve pressure. Now, we all know when we have a pinched nerve in our back because we can feel it. We have back pain, and that can even radiate down our legs or radiate out into our abdomen. Then we know when we have a pinched nerve in our neck because we have pain in the neck, strong pain, and that might radiate down the arms or the chest. But what happens when a nerve is pinched near the jaw from looking down all day at the real base of the skull? Well, then the pain is in our head instead of in our neck or back. When the neck muscles become tight or are out of alignment, the jaw muscles generally get very tight. And the tight muscles or the misalignment right at the jaw and the base of the skull can impinge on the trigeminal nerve root, which nourishes the face, the sinuses, and the gums. So tight neck and jaw muscles can cause sinus headaches, jaw pain, gum tenderness, forehead pain, or pain at the temple. Then neck and jaw tightness can also be severe enough to cause a migraine, which includes face pain. And this nerve bundle is critical to your face, so you can experience face pain from just simply lack of nerve flow, and that can also translate into your migraines. So where your head hurts is important. When your head hurts in a specific location, this is due to lack of blood flow or nerve flow to that area. So you can experience referral pain also, like where it hurts all over or it hurts in multiple spaces, multiple places. But when it hurts in an exact area, this is very telling to us that the blood supply or nerve supply is pinched or impinged upon. You can successfully treat migraines that hurt in a specific area by assisting the blood flow up the neck to the head through the muscles, by relaxing the muscles and stretching the muscles, by breathing slowly and deeply, or doing whatever can alleviate the tension in your neck, and then the pain will go away, often within 10 to 30 minutes. Now, when you have eye pain with a migraine, where the pain feels like it's right behind your eye, this is a similar problem. This is nerves or arteries being impinged upon or impacted, and the flow to the eye is being reduced, and this causes terrible pain. Now, this pain can often be quickly eliminated by giving proper blood flow to the head. So this, just a simple neck misalignment or tight muscles in the neck can cause this type of migraine eye pain. Now, we have these arteries that travel up through the vertebrae, on the sides of the vertebrae, and this is called the vertebral artery. Now, the vertebral artery is vulnerable to impingement when your neck is misaligned. In this slide, you can see at the top of the neck there's a little bit of an impingement on the vertebral artery. The vertebral artery supplies blood to the upper spinal cord, the brain stem, cerebellum, and posterior parts of the brain, which is the back of the brain. Once it reaches the skull, the vertebral artery branches off into several other arteries, which lead to the different areas of the brain. Headache symptoms will vary depending on which artery is impeded and which one is reducing oxygen flow to what specific area of the central nervous system. The basilar artery is part of the blood supply system for the brain and the central nervous system, and it is formed where the vertebral artery enters the base of the skull. The basilar artery is a continuation of the vertebral artery, and it is the origin of a lot of migraine pain. When this area of the neck is tight, which can occur for multiple reasons, then blood flow to the head is lower and not sufficient, and then pain is the result. Here's a closer look at this area where the blood is all coming up through the neck and entering the head right behind the jawbone. Notice it's right behind the jawbone and right below the ear. So right now, just touch this area of your head on both sides. Put your index finger underneath your ear and behind your jawbone and just feel right there. So a lot of migraines that are caused by neck tension will have a sharp pain in this area. The occipital nerve is located both behind the ear and up the back of the skull. There are many occipital nerves that run up the back of the head and behind the ear. When these are impinged upon, you're going to have all different types of migraine symptoms, and usually it will be accompanied by pain at the base of the skull. Now, what can we do about this? So first of all, it's nearly impossible to know which nerves or arteries are being impacted. We have so many that run up our neck. There's hundreds and hundreds of different nerves going up our neck, and there's lots of different arteries traveling to our brain to supply the amount of blood and nutrients that we need. So all we have to do, it's the same treatment for everything, is we need to relax the neck and align the neck and breathe calmly and alleviate the issue of the impingement. Now, there's lots of different ways we can do this. We need to consider neck and back treatments, which include therapy. My favorite is physical therapy because I got the most amount of help from a physical therapist who helped align the top bones in my neck. And craniosacral is another very minute movements that help align the top two vertebrae of your neck, which is generally the problem. If you're having migraines from neck misalignments, it's generally the top two vertebrae because they're the ones that are going to impinge on things that go to your head. Additionally, you can do exercise that helps strengthen your core muscles, your back muscles, and your overall mobility so that you have better circulation through the spine and to the head. Now, another thing you can do is to be ergonomic, which means that you use the body the way the body was intended. You do things that are not strenuous to the wrong muscles. Here's an example of ergonomic desks. You can do both a standing desk or a sitting desk. Your elbows should be at a 90-degree angle, so they're not raised up or raised down. Your wrist should be flat. Your screen needs to be at eye level and below, not looking up or looking down, so that you can keep your head in a neutral position. You want to keep everything in what we call a neutral position. Your legs should be at a 90-degree angle. A lot of the times, if you're sitting at your desk, your feet should be propped up. Your feet should definitely always be resting and never hanging off your chair. All of these things really help to alleviate back and neck issues. And you can look at this in all different ways of work. So in this slide, you can see the gal has a sitting desk and a standing desk. Both of those work perfectly for ergonomics, and her arms are level and her shoulders hang nicely alongside of her, and her feet can touch the floor. And with an adjusting desk, you get to adjust the height of the desk per you, or you get a chair that adjusts so you can adjust it per your height. And you can get a footstool if you need to. Now, there's also standing desks that support people who have back issues, as you can see in this slide. And there's ways to make other work habits and work environments ergonomic so that you're not putting pressure on your back muscles and your shoulder joints and your neck. Here's an example of the auto parts industry and how they have incorporated and adjusted their work environment so that people can work in an ergonomically satisfying environment and support their body and be able to do this type of work all day long. So posture is key, absolute key. If you've had a neck, a back, or a head trauma, the chances that you could have migraines is increased. So protecting your posture is so critical. This means movement, exercise, therapy to correct your posture so that you're standing in the right position and your spine is supported by your muscles throughout the day. And then not allowing your muscles to get tight is another way to prevent migraines, and that's by breathing and taking breaks and stretching. So at home, one of the things you can do is to just breathe and relax on a regular basis. You want to do the exercise you need to strengthen it, do the therapy, but also do the deep breathing frequently throughout the day. And don't wait until your muscles get super tight, because prevention is your best treatment. As soon as you notice your neck's getting tight, do the treatment immediately. Now, once you're at work and you're sitting at your desk, I would really recommend that you set your phone timer to chime once per hour. When your timer goes off, stop your work for a few minutes, breathe deeply, 3 to 5 minutes, and then do some simple stretches that twist the spine to increase spinal fluid getting up to your brain. You can get your whole office to chime in with this, where once an hour you all stretch, move your spine, and help that neck and help the spinal fluid be moving up and down. It is so important to take care of your neck and your back. And if you do, they will take care of you.